Hello friends, welcome back to Complete Medical Coding. Today let's discuss few evaluation and management mock questions. Okay, we will discuss few guidelines from the E&M session as well as some important mock questions also. So friends, if you are new to the channel, please subscribe and please watch out and like and share my videos. Okay, so let's move to the questions directly. What's the first question? And a 72-year-old patient is in the hospital after she had a stroke with late effect hemiplegia to her dominant side. She was transferred to a nursing facility. Dr. Sam, internal medicine specialist, documents the high risk of complications due to extensive medications and management of multiple systemic diseases. Dr. Sam talks with the rehabilitation team regarding Anne's physical activities, including a plan for physical therapy. What codes are reported by Dr. Sam? Okay, so here you have to code for, you have to find out the exact diagnosis as well as the correct E&M code. So here E&M code is, as you have read the question, it will be something related to nursing facility, either rehabilitation or no, not rehabilitation, because Dr. Sam talks with the rehabilitation team. It's only just transferring the message. Here you have to code for the nursing facility. Yes, see the second sentence. She was transferred to a nursing facility. So you have to code for nursing facility. Okay. And what is the diagnosis here? Late effect hemiplegia. Anyway, the diagnosis code is same in all the options. If you want, you can just cross check. Still, since in all the options the diagnoses are same, you don't have to waste your time behind that. Okay. Anyway, let me just tell you what it is. I69.351. Okay, you can check also. I69.351. It represents hemiplegia and hemiparesis following cerebral infarction affecting right dominant side. Side here it is on her dominant side. It doesn't mention right or left. Anyway, it's on the dominant side. She had a stroke effect with late effect hemiplegia to her dominant side. She was transferred to nursing facility. Now, you have to code for the nursing facility E&M code. Okay, that is what you have to find the procedure here. So, let's move with the codes. See what are the options, what are the codes given here. It starts with 99304. It's a sequence. Everything here mentioned here is nursing facility care only. Okay. So 99304, 99305, 99306 and 99307. From that you have to find out one code. So just go to the nursing facility section under E&M starting 99304. Let's find out. So here 99304 is initial nursing facility care per day for evaluation management of a patient. It requires detailed or comprehensive history, detailed or comprehensive examination and medical decision making is of low complexity. 99305 is same initial nursing facility care, comprehensive history, comprehensive examination and MDM is of moderate complexity. 99306 again nursing facility, initial nursing facility, comprehensive history, comprehensive examination and MDM is of high complexity. 99307 it's a subsequent nursing facility care. Subsequent. Anyway, this is not subsequent. This is the first time that the patient is being transferred to a nursing facility. The first time that is the patient is in the nursing facility. That is why it is mentioned as the patient has been after the treatment. After finding out her complaints, the patient was transferred to a nursing facility. It means it's an initial nursing facility care. So 99307 is not applicable here. Okay. And here since the patient is having stroke, the patient was having a stroke with late effect hemiplegia. Stroke with late effect hemiplegia. Okay. And then high risk complications. The doctor documents the patient is having high risk of complications due to extensive medications. Okay, so since this is high risk of complications, this will fall under MDM of high complexity. Okay, so MDM high complexity means the correct CPT code will be, the correct E&M code will be 99306. So the answer here is option C. Okay, 99306, MDM of high complexity that you need to code. And then diagnosis, which is the same, hemiplegia, I69.351. Okay. Now let's look into the second question. A 10-year-old girl is scheduled for her yearly physical examination with her pediatrician. During the visit, she complains of watery eyes, scratchy throat, stuffy and running nose for the past 2 to 3 days. The doctor performs the physical examination as part of the routine visit. Also, he performs an expanded problem-focused history and examination and then treats the patient for upper respiratory tract infection. You might get short form as URTI also, okay, for upper respiratory tract infection. It's URTI. What CPT codes are reported for this visit? So here the patient came in for the periodic evaluation. Okay, periodic evaluation, which will fall under preventive medicine section, periodic comprehensive preventive medicine part. Okay, so the patient is here to treat the patient is here for a routine checkup, but along with that, the patient had complained that she was having watery eyes, scratchy throat, like all those symptoms related to the respiratory infection, okay, since the past 2 to 3 days. So what did the doctor did? The doctor performed the routine checkup, okay, the examination, physical examination as part of the routine checkup. Also, he treated for the URTI. He had done a detailed and expanded problem-focused history and examination for the URTI. So you have to code for both. Okay, since for E&M you have to code it separately. So let's see what is the exact, or how to do the exact code. If you can check the options, the codes are same. There are two codes, 99393 and 99213. From that you have to identify either we need to code only 99393 or 99213 or together. Okay. So what is 99393? As you already know, the patient is here for a routine preventive medicine examination. Routine periodic examination. That will fall under preventive medicine section. So 99393. 393 is the same periodic comprehensive preventive medicine. Late childhood, age 5 through 11 years. This is 10-year-old girl. So 5 through 11 years you have to select. That is why 99393 code. And what is 99213? If you can check 99213, that is for the the E&M code for URTI, the treatment of URTI. Okay, the office visit, office or other outpatient visit. This is an established patient, because since the patient is for a yearly health examination, a routine examination, it will be for sure established patient. Okay. So an expanded problem-focused history, problem-focused examination, and MDM of low complexity. So here, yeah, expanded problem-focused history and examination had done for this patient, and the decision making is low because the diagnosis is only URTI. So 99213 also you need to code. Why is the modifier 25 added? What is modifier 25? Modifier 25 represents when we will use modifier 25. When a separate identifiable E&M service was performed. Yes, this is a separate E&M service, right? The one E&M service, which is preventive medicine, that is for the routine health checkup, and the other E&M service is for the treatment, that URT, that acute treatment, acute illness treatment. That is also an E&M treatment. So in that case, you have to mark it as along with modifier 25. And which should be primary? Should we use the modifier as primary, as in option D? See, 99213 with modifier 25. No, modifiers always you should mark in the secondary CPT, not primary. We should not use modifier in the primary code. So Here the correct coding sequence will be option B. Okay, 99393 and 99213 with modifier 25. Now moving to the third question. The provider admitted a 16-month-old infant to the hospital from his office to rule out sepsis. The infant is crying inconsolably. He has a large amount of gas in his bowel, no hematochezia associated with it. A comprehensive history, comprehensive examination, and moderate decision making is documented. Cultures are negative and the patient remains febrile for 48 hours. The infant will be discharged home. What CPT code is reported for this visit? So here this is a hospital visit for ruling out the sepsis. Okay. So it's clearly mentioned in the first sentence. The provider admitted. This infant has been admitted by the provider from his office to the hospital. So it means an initial hospital visit. Anyway, let's move to the options, the codes. And this is not a severe case. This is a acute case because it's mentioned if cultures are negative, and if patient is febrile for 48 hours, it means after observing the patient for 48 hours, the patient will be discharged. Anyway, what is the first CPT code? 99222. What are the options here? 99222, 99238, 99223, and 99239. Let's find it out. So 99222. 99222 is initial hospital care. Yes, this is an initial hospital care. Okay, which requires comprehensive history, comprehensive examination, and MDM is of moderate complexity. And there is 99223 in option C. Same, initial hospital visit, comprehensive history, examination, and MDM of high complexity. Now, what is 99238 and 239? 99238 and 239. Hospital discharge day management, 30 minutes or less. And 99239 is hospital discharge day management, more than 30 minutes. Both are wrong. Both are wrong codes because this is discharge management. It has just mentioned that if in case if the test results are negative, the patient will be discharged after 2 days. It's written like that, right? Doesn't mean that this is a discharge management. The patient is here now to rule out the sepsis. So these two codes are wrong. 238 and 239. 99238 and 99239 are wrong codes. So it should be 99222 or 223. Here the MDM is moderate or high. Moderate decision making. It's mentioned there. A comprehensive history examination and moderate decision making is documented. So it means the answer will be option A, 99222. Okay. Moderate decision making. MDM of moderate complexity. Comprehensive history examination and MDM of moderate complexity. So 99222 option A is the answer. Now fourth question. Mr. John, a 38-year-old established patient, is being seen for management of his hypertension, diabetes, and weight control. On his last visit, he was told he had a diabetic foot ulcer and needed to be hospitalized for this condition. He decided to get a second opinion and went to see Dr. Myers. This was the first time Dr. Myers had seen Mr. John. Dr. Myers documented a comprehensive history, comprehensive examination, and decision making of high complexity. He concurred with hospitalization for the foot ulcer and sent a report back to Mr. John's primary care doctor. How would you report Dr. Myers' visit? So here you have to code. The question is only to code Dr. Myers' visit. How you will report Dr. Myers' visit? Okay. So here what did Dr. Mayer did? Dr. Mayer documented comprehensive history, comprehensive examination, and decision making of high complexity. So you have to find out only that E&M code. Okay. Anyway, let's move to the options. What is the first one? 99245. 99245 is office consultation for new or established patient. Comprehensive history, comprehensive examination, MDM of high complexity. Of course, we need MDM of high complexity, but this is office or other outpatient consultation. Yeah, this is office consultation. Okay. What is the next one? 99205. Again, office or other outpatient visit, which requires comprehensive history, comprehensive examination, and MDM of high complexity. What is 99215? This is office or other outpatient visit for an established patient. 215 is for an established patient, which requires again the same what is mentioned in the question, comprehensive examination, history, and MDM of high complexity. But this is an established patient. Since Mr. John is being consulted with Dr. Mayer for the first time, this is not an established patient. This is a new patient with Dr. Mayer. But if the question is asked for to code the report, to code the services with Dr. Who is the first doctor? The PCP, first doctor, the primary care doctor. Name is not mentioned here. Okay. Then in that case, this patient is established patient. But since Mr. Jones primary care doctor, PCP, okay, it's called as PCP. Mr. Jones PCP has been sent to Dr. Mayer, and you have to code for the Dr. Mayer's visit. So it means, Dr. Mayer services, it means this is a new patient with, Mr. Jones is a new patient with Dr. Mayer. So 99215 is wrong. What is 99255? 99255 is inpatient consultation. Inpatient consultation with the same components, comprehensive history, examination, and MDM high complexity. This is not inpatient consultation. That's also wrong. So you have to identify whether the answer is 99204 or 245. 204 or 205 or 245. So since this is a new patient office visit, it's not, you can't go for 99245 because that is directly office consultation. For new or established patients, this is the first time office visit. You have to code for, if it's the first time, you have to code always the office visit code, which is 99205. And the components are correct. Comprehensive history, examination, and MDM of high complexity. Okay, office or other outpatient visit. So the answer will be option B, 99205. Okay. Now, one more question. Okay, fifth one. James, a 35-year-old new patient, received 45 minutes of counseling and risk factor reduction intervention services from Dr. Kelly. Dr. Kelly talked to James about how to avoid sports injuries. Currently, James does not have any symptoms or injuries and wants to maintain this status. This was the only service rendered. How would you report this service? So, Dr. Kelly talked to James and just instructed him to avoid sports injuries. Only that is the only treatment done. And he does not have any current symptoms or injuries. So, this is a simple one. Anyway, let's find it out. What is the code? What is 99213? Let's check what are the codes here. 99213. Office or other outpatient is for established patient. 99213 code is for established patient. But here, James, this is a new patient. So you can directly skip that. Even 99203. Yeah, that is new patient code. 203 is new patient code. Detailed history examination and MDM of low complexity. What is 99385? 385. Initial comprehensive preventive medicine. 385. Preventive medicine for services 18 to 39 years. Yes, this is 35-year-old patient, new patient. 385 could be. Okay, what is 99403? 403. See, it falls under counseling, risk factor reduction, and behavior change intervention. This is what we need. The patient received 45 minutes of counseling and risk factor reduction. So you have to go for this one. 99403. Approximately 45 minutes. Yes. Counseling and risk factor, preventive medicine, counseling or risk factor reduction intervention provided to an individual, approximately 45 minutes. So 99403 is the answer here. Okay, answer will be option D. All right. So this is what the preventive medicine, I mean the counseling and risk factor code is. Okay. So friends, hope you like the video. There are more and more, like it is like n number of guidelines for E&M, especially from E&M section. Okay. And there are n number of questions, twisted questions, direct questions. So many are there from E&M session, and it is little difficult to understand this part. So in the next episode, I mean in the upcoming section where I'm going to take E&M in the next part, I'll be coming back with few important points and guidelines only. Okay, then you can like along with some examples. So like that, you will be able to find out. You can easily understand what is the main concept of E&M. Okay, so friends, if you are new to the channel, please subscribe and support me. And thank you so much for all your support. Stay tuned and please watch, like, and share my videos. Thank you so much. Bye. Take care.